Hello and welcome back to Tik-Tokophobia with me, Alexia, and my co-host JJ. Hi, JJ.
Hi, good to be back again.
It is, it is. Now, today we're going to be talking about the Tocophobia healing journey because it is not a simple thing that it's the same for everybody. It has many, many colors, many permutations. And so this is what we really want to dive into today because it's worth understanding when you suffer from tocophobia, what that healing journey could look like. So we want to talk that through with you today. So where should we start on this one, JJ?
Well, why don't you see so many women who are going through this issue, this disorder, this journey? What does that journey look like when they're healing it? What do you see?
Well, I think a good place to start is a starting point because it really does depend on where you are at the beginning. Like, what does the beginning look like for you? And this is where it can already be very, very varied depending on where you find yourself and what you're wrestling with. So there are some women that know they have a thing called tocophobia, and maybe they've only just learnt the name for it, but they've always known that they've been scared of pregnancy and they don't want to go near the whole idea of childbirth and holding babies. They've known that. But then there's a level of knowing that isn't really very conscious. And it starts becoming a little bit more obvious as they approach that time that you could say, let's say body clock red alarms going off, let's say 30s, for example, where it's like, oh, hang on a minute. There could be pressure from the partner or the husband. They could be thinking, oh, body clock. The whole reason we've called this podcast Tik-Tokophobia, right?
Yeah,
And then they start
yeah.
thinking, hang on a minute, there might be something going on here. And I was speaking to somebody just today, but she's like, well, I never really liked to hold babies, and I've never really thought of myself as maternal. But recently, with noticing all my friends getting pregnant, I just think there's something else going on here, and I just need to know because my husband he wants kids, and we need to make a decision whether we stay together. I mean, that's a big deal.
That's huge. That
That's
is
huge
huge.
right there, right?
Yeah.
So her objective is to figure out, does she really have this thing? And if she does, can she get rid of it so that she can make a decision for herself whether or not she wants kids or not? Because she needs to be able to make that decision so that she can be at peace with this when she's out through when her reproductive years are over, so the beginning can be, have I got it? Is this what I've got? Right. And for her, the engine is, I just need to know whether or not I want kids or not. And that knowing is a very, very important step because some women don't have that. Does that make sense?
Oh yeah, no, well it does, yeah, because I always say that you have to know really first of all before you can start to heal it. So
Yeah.
that knowing is so important. It's crucial.
Yeah. Yeah. Yeah.
And
Yeah.
but then what about the women who don't know they have it? What goes on there?
Well, I think the women that don't know they have it, then so if they don't know they have it, and then for the women that I've come across with, then suddenly they get pregnant, right? And then it hits them. Then they see the two lines, and we've talked about this, the delineate, the
Yeah.
cast moment. And so suddenly they're like, oh, I need to now be okay with this. I'm now pregnant, I'm carrying a baby. Do I want to keep the baby? Because this is a question that many of them ask themselves. And it could be that they spend the first month, 2 months contemplating termination because they don't know if they're going to be able to handle this. They need to be able to resolve how they're feeling in order to be able to continue with the pregnancy. And so for somebody in that situation, the goal is, I need to just be okay with being pregnant. Like,
Mm.
I need to be okay with this and not think like I have to choose between me and the baby. And that's a very, very big decision to have to face, right?
It
So
is.
the goal could be being okay with pregnancy and being pregnant. And some women might have that as a goal before they're pregnant. So it could be that there are women that are terrified of the pregnancy. And then when they start with, they go like, at the moment, pregnancy just feels too much. I just want to be comfortable with the idea of pregnancy so that I can see it through. Because in their mind, 9 months of pregnancy just feels like a prison sentence. It will worse than that, a psychological prison sentence, because that's a long time to be in a panic attack. If you were to say to somebody, how do you like to do a 9 month panic attack? Everyone would be like, no, not for me, thank you. And that's what that could feel like. for women. So in order to be okay with pregnancy. So maybe that's the goal. Maybe that's where you want to get to. And then as long as I can handle pregnancy, get me to my C-section and all is good. However, some women might be like, no, but I don't want to go through surgery. I know the power of birth. I really want to be able to have that for myself. So I've got another client, she's like, I really want to have a birth in a birth center or at home, and I want to be able to birth vaginally, and I want to do all of that. But there's a lot around that that makes me very scared. So I want to get to that place. So this what you start to realize is this healing journey has got many phases that depending on where your level of self-awareness is, what kind of support you've had around you, what state your mental health is, whether or not you might be suffering with things from anxiety and things like that, that it might be that at the beginning you're like, I just want to be comfortable with the idea of pregnancy so that I can get off birth control. It
Yeah.
could be I just want to be able to make a decision, because there are some women that are like, I don't know if I can say yes to my husband about this. I don't know if I can give him the green light that we can start trying, right? So she needs to be comfortable with the idea of pregnancy. But then once it's like, okay, we're trying. Yeah, we're trying now. We're off to the races. Oh no, okay. Intimacy now. Actually, they realize intimacy, sex is a problem. I really struggle with it because I might get pregnant. So we haven't really done all the work necessarily around the pregnancy or being pregnant. So you've got these kind of like decision. Do I want kids or not? I need to know that. Can I do sex? Can I do the trying phase, the TTC phase? Can I do that? Am I comfortable with pregnancy and being pregnant and carrying this baby? And then what about the birth? How do I feel about the birth? So there are these kind of like these phases, these portals, if you like, that you need to kind of go through. And then slap bang in the middle of all that, if you do decide you want to try, is the fertility journey, which that's a whole thing in its own right. That can be, then you're into IVF possibilities if you're not getting pregnant. But the complication that you have with tocophobia is that there's a part of them that really wants to get pregnant, and there's another part of them that desperately doesn't want it. So every time they get their period, and it's you're not pregnant, there's this like conflicted feeling of like, oh, oh, but I really wanted to. Oh, and what a relief. Like in the one part, they're both relieved that they're not, but they're also really disappointed that they're not. And so that emotional conflict and up and down doesn't help fertility, because fertility, your body needs to be free of stress as best as possible in order to feel like the baby, conception to take place. So there's, as you can see, there's a lot going on in all of that.
Yeah.
And maybe it can be helpful to think of that in terms of what's the chronology of that journey. There needs to be the decision. Then there needs to be okay, let's start trying, in inverted commas. Then there's what does trying involve? It means getting off birth control. It means having sex, unprotected sex, and all of those things could be, even just getting off birth control could be hard.
Yeah. Yeah.
Having unprotected sex can be hard.
Mm-hmm.
And then waiting for your period or not, or the sign or the two lines, like all of these are really key stages on that journey. And it can be useful to think of it almost like a train line with loads of stops, and you might get on at any stop, and you might stay on for a certain while and get off at any stop, and then come back on again later. It really is, and that this whole journey could last 2, 3, 4 years, 5 years, right?
Yeah, absolutely. Absolutely. And then what about the case where tocophobia isn't really consciously about giving birth to actual babies? There's another level of it, isn't there? Which is not so much showing up as a conscious fear of birth or a conscious fear of, getting pregnant or, periods or anything like that. It's something far more to do with being seen or showing up or creating in another way. What about that?
Well, I mean, this is really interesting. And I think this is definitely for those women where they don't realize they have it, where they may have made that call, I'm not going to have kids, or maybe they've had that experience of getting pregnant, a lot like yours. And you looked at you had that moment of pregnancy and thought, I am not doing that again. And so you never put yourself in that situation again. And I've seen many women, I've worked with many women that are at the later, post childbearing years, that haven't had kids, and that have with birth wounds. Let's call them wounds around natal wounds, if we want to call them
Yeah.
that, around their own birth. But it could also be maybe they had an abortion, that they've had to carry as well, the pain of that. So let's call them, yeah, natal wounds in whatever, reproductive trauma. And that can really stifle creativity and really hold you back. And I'm seeing this more and more. And it's an area that I'm very curious about, because just this week, there's somebody that I work with, and she's, business, she has her own business, therapeutic practice, does lots of incredible work. And she's been really struggling to be visible in her business and posting on social media and just being out there so that she can get clients and things. And that's been really hard for her. And this week I've noticed that she's all over the place doing videos, and I'm like, what on earth is
I know, it's
going on
brilliant.
here?
And I
It's
can
been
totally
great.
empathize with that, right?
And I messaged her, I said, what is going on? Like, how come you're suddenly all over, like, all over the platforms? And I've been trying to do this for like a while. She's like, I know, I finally got around to doing your birth wound healings. And I was
Yeah.
like, wow,
Yeah.
wow, okay. And we hadn't really worked on tocophobia per se, because, she's post childbearing years. And so that hadn't been a focus of work that we'd been doing. But isn't it interesting how when she got round to healing her own natal wounds, suddenly that opened that part of her to be seen, to be creating in public, to be creating something for herself. Because creation, birthing something, isn't just about babies, is it?
Yeah. No, absolutely. Absolutely not. But it can impact your life hugely.
Yeah, no, for sure, for sure. So I think when we think about the healing journey, with to do with reproductive anxiety disorder, it really, I think the beginning of it, it really comes down to understanding what it is that you're dealing with and naming it. And this is why we've named reproductive anxiety disorder, because even just naming that makes things make sense. Suddenly you look at it through the lens of reproductive anxiety disorder, like, wow, okay, now my experience makes sense.
Yeah.
And then this is why
Yeah.
we've named the delinea moment and the cast, because now it's like, okay, now I've got language to deal. I can now hang my experience on something that makes sense, and I can talk about this with somebody who understands, right? That's the first part. But even then, you've now got to find people that can support you on that healing journey. And this is another bit that makes my blood boil a little bit, just a little bit. Like this lady
No, surely not.
no, no, I know, right. The lady I was speaking to today, she's like, well, I went to speak to my therapist about this. And she's also spoken to somebody in the maternity unit. This is in the UK. And she said, oh, and the lady said, oh, so when you think about carrying a baby, that doesn't feel natural to you. And she's like, no, I can't even hold baby. She went, oh, that is strange. I've
I
never
know.
heard that before. And it's like,
I know.
what?
I know. Don't.
What? No, I know, right? What? How are people? Anyway.
Yeah, exactly. No, we're both aligned on that point. But that is what you are up against often, right?
Yeah,
You're up against a total lack of information on the part of people who are trained to look after women in this area.
yeah.
And it's a real shame that we haven't in this day and age got that awareness. Yeah.
No, I know the women that I've spoken to that have been to their doctors who don't know what the hell it is. They again, this lady this morning, she went, I had to take a PDF into my doctor to explain to him what I was suffering with. Like, that should not be happening,
Yeah.
especially when we're talking about something like, humans have been around for a while, right? We've been birthing babies for a while. This isn't a new thing. Why do the professionals not know about this?
Yeah.
It's infuriating. And but I'm not going to digress onto that. But so the first point is that it is about naming it and understanding what you're dealing with.
Absolutely. Yeah.
Once you've got that, then you can start thinking a little bit more clearly about what it is that you're like what is it that's going on here. And the other thing that's really interesting that I've observed with the women I've worked with is that is the chronology kind of stacks that like imagine that you are walking late at night and you go down a dark street and there's like a group of guys that like suddenly look quite threatening and there's a female walking at night. I think a lot of women will be able to relate to that experience.
Yeah.
And then the police later on go, what would they look like? You know, like, oh, I don't know. I could just see the one at the front, right? Because you probably can't even say how many there were because your focus is the guy at the front, the one at the front looking all whatever.
Menacing.
Exactly. So all your focus is on that front one.
Mm.
Once the front one's been dealt with, then you're like, oh my God, there are these other four behind. Oh, and he had a blue t-shirt and blah, blah, blah. So suddenly you've got that visibility, that clarity.
Mm-hmm.
That's the kind of thing that I see with this tocophobia journey, is that the main focus, so getting pregnant could be the thing that like that is really the main focus of it, which is getting in the way of trying to conceive, which is getting in the way of intimacy, which is getting in the way of having sex and getting off birth control, because the big fear then is being pregnant. Once the pregnancy fear has been dealt with, and once I've helped my clients be comfortable with pregnancy, then they're like, oh, hang on, there's birth next. And they've never, ever, ever thought about birth. Like that has been like a thing they've never considered. Mm-hmm. I mean, I don't know if you imagined giving birth.
I have, but I haven't been able to fully, sometimes when you imagine something, right, you can really get into the feeling of it and really get into it. If I've ever imagined it, I've been a bystander.
Right. Okay.
Right.
Like watching it happen.
Yeah. Watching it happen. Exactly.
Yeah.
And not feeling it or really engaging with it, but kind of, television screen of me having a baby.
Fine. Yeah. Okay. Disassociated.
Not actually, exactly. Disassociated.
Yeah. So because there's a lot of women that I've worked with, because all of their focus, the fear focus, let's say, was on the pregnancy, they've not even considered birth. So I'll say, like, so if you thought about what that birth could be, if you know C-section or birth, like, oh no, I've not gone there. That's just a big dark corner. So now the fear of pregnancy is out the way. It's like, oh, now I can start thinking about birth. Okay, so what would I like? Would I like a birth? What that look like for me? And what are my reasons behind maybe a C-section versus, is fear driving the C-section choice? Because let's be honest, fear is what's driving the C-section. That is absolutely what's going on.
Yeah, absolutely.
There are only maybe 5% of births need to be C-sections for medical reasons. The rest, which takes us up to like the rest of those births are down to fear, right? That's absolutely what's going on. So it's about pinning down the reasons behind birth choice. And again, if someone wants a C-section, they can have whatever birth they want, right? But it's about being honest about your choice. And if you are on a tocophobia healing journey, that's about healing your fears. So if you're considering a C-section, what are the reasons behind that? And if you're saying that as somebody who's not pregnant, then it absolutely is fear-driven. That's absolutely the case. So you can choose if you want to go, you know what, that's fine. I'm fine with my C-section. That's what I want to do. And all I wanted to do was be a mum, have my baby, be able to be pregnant, hold that pregnancy and be comfortable with it and birth my baby. And I've done what I needed to do now. And I'm gonna stop my healing journey now and I'm gonna have my C-section. And that's perfectly fine, right? So for them, they get off the train at that spot and then they go off and they have a C-section and then they're a mother, they've achieved the thing they want. Whereas some continue like, oh, and I don't want a C-section. I want the vaginal birth. I want the home birth. I want the da-da-da-da. So they have to, there's a continuation there to kind of continue with that work so that they can be comfortable with the birth. So yeah, it is this and then of course, if you've got the fertility journey in between, then that's a side track that you then have to explore and resolve depending on what's going on there, whether it is, what's going on there. So it is not a straight line because, sometimes you do the healing work and then it's like, yeah, no, I think I've got it. I think we're good. I think we're good. And then, oh no, no. I thought I was, but I'm not. I need to revisit some bits.
As it is with any healing journey, but I guess to put it in a nutshell, it's about naming it, owning it, and being able to make choices which aren't coming from a place of fear.
Yeah.
And then doing all of that, being enabled to do all of that in a very supportive environment where people get it,
Yeah.
people understand, they know what you're doing, what you're going through.
Yeah. And that I think that point about making the decision not out of fear is so important because so many women are unwittingly making the decision not to become a mother from a place of fear. And they don't
Yeah.
realize that that's what's going on, right?
Mm-hmm.
And I've had women come to me after, like, let's say mid to late 40s, early 50s, when that's it, that it's too late for them now. And they now realize that it was from fear. Because it's quite interesting that the minute the reproduction capacity ends, the fear subsides because now it's not a real threat. And so now they see it for what it was and realize that fear was behind it, and actually they wanted kids the whole time and
Yeah.
they couldn't access that part themselves. And so to have an opportunity to make that decision not from a place of fear is, I think, one of the biggest gifts you can give yourself as a woman.
I agree.
Because you
I
can get
agree.
to that point and think, no, I don't want kids, and that's fine.
Mm-hmm.
But I know I'm making that with my heart,
Mm-hmm.
not from fear.
Yeah. Yeah. Yes. And not get to a point where you look back on your life and think, oh, I could have, I should have, I would have, I did want to really, but there was just this
Yeah,
barrier
yeah, yeah,
in the way, and I didn't even know it was there,
yeah,
which is often the case.
yeah,
Yeah.
yeah, yeah. No, I know. And I, when I think about my journey, I just wish, I was able to get in at the last minute. Can I realized and was able to get in there
Yeah. Yeah.
before
Yeah, you did.
I
Yeah.
got the end of my own reproductive cycle. And I'm grateful that I was able to do that. But
Mm,
I really wish I could have figured this out sooner,
mm,
because I would have much preferred to be a younger mother than, I'm an older mother, and I would have preferred not to be an older mother,
mm.
but I am a mother. So I'm so grateful that the tocophobia is there and that invited me to do this healing work.
Yeah.
Um, so it is, yeah, it can take many, many forms, and it can take a long time. And I
Yes.
think this is the other part
Yeah.
of this, is that I get this question a lot as well, like, well, when should I start addressing my fears? Shall I wait till I'm pregnant? I'm like, no, 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 don't do that. You don't know how long this is going to take you personally. Like, I
Mm,
know with the work that I do how quickly I can turn this around.
mm-hmm.
But that's based on me working at my pace, and not everybody wants to work at my pace.
Exactly.
Um,
Yeah.
you've got to work at your own pace
Yeah.
and find what works for you, because my approach might not work for everybody either, right? So you need to give yourself the chance to work through this and figure out where it's come from, what's going on, because another kind of piece that maybe we haven't talked about yet fully is the mother wound, right? So one thing that comes up on that, when I talked about those scary characters in the dark alley, one of those is the mother wound, possibly.
Mm-hmm.
You don't
Yeah.
realize that one's there
Yeah.
until you start
Yeah.
digging, right?
Absolutely. Yeah.
And then you're like, well, I'm going to become her. Now, who was she, your mother? Was she nice? Did you have a good relationship? Was she an absolute cow? Are you terrified about becoming that?
Oh,
Like, what?
we need to do a whole episode on that, right?
Yeah.
Because I've got
Yeah, yeah. So
got
when
so
I'm
much on that.
yeah. So when I'm working with people on this, suddenly the mother wound shows up. You're like, oh, hang on a minute.
Yeah.
This requires a lot of work.
Yeah.
Because in order to be a mother, you have to confront motherhood and what that means to you. And of course, your mother is part of that meaning. And so
Absolutely.
in order for you to become a mother, you have to now face and confront all of that. Um, and you don't have to. No, of course you don't have to. But if you don't, you're just brushing stuff under the carpet. Let me just say that it'll show up at some
You
point.
are, and it will show up at some stage. But also, think of it this way: is that you're stopping yourself from expressing your full being because you've got all this stuff going on underneath the
Yeah,
surface, which is preventing you from from blossoming, really,
yeah. And being happy.
and being happy. Yeah, yeah,
Yeah, no, that's one thing. Like when I get women asking me, like, well, should I just wait till I was like, no, do this as soon as possible. Like,
yeah,
why delay your happiness?
yeah.
Right now, you're wrestling with anxiety or tocophobia or fear or
Right.
some dis-ease, emotional dis-ease. Why prolong that?
Yeah.
What is it that's preventing you from saying, I deserve, this is a life I've been given that I
Yeah.
have, and I want to be happy in this life, and I don't have to wait until I'm, I don't know, like what, why not want that for you now? And
Yeah.
so for anyone that has any kind of emotional disease, any stress, anxiety, for me, it's like, well, just work on that stuff as soon as possible, because the sooner you do, the sooner you're at the other side and can enjoy life from a place of joy and happiness and, all the things
Yeah.
that come with that, that's not worth delaying. Whether or not you decide motherhood's right for you, just get that stuff, do it, do the healing. So for me, I think for women that are thinking whether or not they have this, and this is why we've got the Tocophobia assessment on the website,
Yeah.
so that you can get an understanding of what level of tocophobia you have, because it could be just mild. You could have like it doesn't even not even tocophobia, it could just be mild to moderate birth fears. You could just be
Yeah.
having regular
Which is,
fears around birth.
yeah, which is absolutely normal.
It is. I mean, it's a
Absolutely.
big life transition. It's a big
Yeah.
deal having kids. You've got to figure out whether you're ready for that, there's a lot to think about. Just if you're going to move countries, you probably have a few kind of like concerns and
Oh,
fears
yeah,
around doing
totally.
that, right?
Yeah.
Any big transition is going to bring up things that you need to explore within yourself.
Yeah.
So the assessment will help you to identify what level of tocophobia you have between mild, moderate to severe. And that's a good starting point in terms of understanding potentially what that healing journey could look like. Um, and give yourself the chance to work through that without adding unnecessary pressure. Because if you're doing that when you're 37 and you're thinking, this could be my last period, you're not giving yourself the best chance
Yeah.
of doing that. Do that as soon as you figure something, you realize that there's something not quite right. It would be my recommendation.
Yeah. I think that's right. And then to inform yourself and talk to somebody who will understand, not necessarily your GP or somebody at the clinic that you're going to, but there are people around who can help you, and we're here to support
Yeah,
as well. So
yeah,
get in touch with us if you have any questions.
yeah, yeah. Good. Okay. Is there anything else we need to say on this? I think this is we've kind of explored the extent to which the healing journey can take. And of course, I've got ways of working with women, and I'm training more practitioners at the moment so that there's more people that work with the way that I work. So if you want to find a practitioner to work with you using the way that I work, they can meet myself or my practitioner. So do get in touch with
Yeah.
the Fearless Birthing site or the Tik-Tokophobia site. And if you're a professional listening to this and you want to work with women, then come and let me know, and you can take part in the training so that you can be one of the people that is there to support women through this, because there is a huge demand for this kind of work, and women unfortunately are not being catered for, and it
No.
just
No.
makes me so mad.
And me, and let's just say as well that if you are a therapist, it's a brilliant add-on to your offering as a therapist,
Yeah,
because you might see people coming to you, and maybe you haven't been aware of this thing called tocophobia, but now you know what it is, and you would be able to help specifically for that.
yeah.
So yeah, it's a brilliant training to go through.
Yeah. And for those of you that want to find out more about tocophobia or reproductive anxiety disorder, there's the white paper as well that you can download off the Tik-Tokophobia website or the Fearless Birthing website. And this really, it talks a lot around what reproductive anxiety disorder is, why it's so much bigger than tocophobia. There's some market data in there, prevalence rates and all of that, and why we need to start really taking this much more seriously, and why mental health professionals, perinatal professionals, need to start adding reproductive anxiety disorder putting it on their radar, so that they're asking the right questions when women are coming to them, so that they can shine that light with that woman, say, hey, is this what you're going through? Does these things resonate? You might have reproductive anxiety disorder, and that can really help that healing journey. So,
Yeah.
if you're a woman who has tocophobia, ask the people that you're going to see, say, I think I've got reproductive anxiety disorder, because this might help them to better understand what you're going through, because they're used to dealing with anxiety, and tocophobia is a severe anxiety disorder but is shaped around reproduction. So maybe that might help them better understand what you're going through and to help you on that healing journey. Because we need to start educating, and that doesn't just need to come from us here. That can go from the women going in saying, hey, do you know about
Yeah,
this? Here's a link,
yeah.
read this. I need you to be on
Abs-
the case with this, right?
Absolutely. And
It's
don't
a
stand for anybody saying, just go away and have a couple of babies and you'll be fine.
no, exactly. Just don't deal with whatever shrug off you're going to get. Like
Yeah,
we need to kind of put people on the right track here and guide them because no one else is doing this for us. So we've got to do that. So let's do it together. Yeah.
absolutely. Oh, I think that's a great place to leave it.
Yeah.
And
Brilliant.
we'll have lots more. We've touched on a couple of things that we will explore more
Yeah.
in future episodes. So,
Yeah.
but I think that's a great place to leave today.
Brilliant. Okay. Well, we'll see you guys next time. Bye.
Yeah. See you next time. Bye bye.